I'm Dr. Jennifer Rodriguez. I'm an interventional cardiologist at the Cardiovascular Institute of the South in Meridian, Mississippi. I have the best job in the world. So I always joke that we mend broken hearts, and that is the goal. Heart disease is the leading killer of both men and women in the United States. And it's the kind of job that wherever you go, you know that there's a need. What I particularly love about my job is helping patients realize that they do have control over their health, that they do have control over how they feel, and how to really fight against some things that they may not have felt empowered to do before. I think medicine in general can seem very scary. I think illness can be a bit of a black box. And nowadays we have a lot of patients going to the internet for general advice that may not be pertinent to them. So I love being a guide to help patients find the best part of themselves. One of the things that I really like about cardiology is that I think it's a blend between primary care and a specialty service. And it's also a mix of general medicine and surgery in a sense because of the procedures that we do. So one of the things that's great about it is that we get to know patients, their families. We often take care of them families at a time because they have the same risk factors. And we really get to follow them through different stages of their lives and be there for the ones that end up with more emergency situations in the hospital as well. So it's nice to be able to do both in one specialty. So a very common question is, when do I need to see a cardiologist? Now, obviously, a lot of times the primary care provider will decide, I've detected something, seen something, or heard something in your symptoms or your family history that concerns me. But sometimes patients just have a general concern about their own heart and want to know if it's time for them to see a cardiologist. Of course, I'm biased, but it seems like there's a lot of reasons to see a cardiologist. So certainly we are there for people that are having symptoms or concerns of heart disease. One of the tricky things about heart disease is that the symptoms are not always clear-cut and they can overlap with other things. And so we like, if patients have concerns, to come in and let us listen to them. Let us look at your risk profile. Let's hear about your symptoms and decide if further testing is needed, and if so, what kind. That's one setting if people are having active symptoms. We also get a lot of patients that have a family history of heart disease, and they don't want to be another statistic or another number. They'd like to do a little bit better than what they've seen their family members go through. And that's where primary prevention comes in, when we're trying to keep the horse in the barn, so to speak, and really decrease a patient's risk of developing heart disease. Often we encounter patients in the hospital for the first time. Unfortunately, 2/3 of massive heart attacks happen in people that had no prior symptoms. So often when we meet people, we joke that they'll say, I was perfectly healthy till I met you. Now, they didn't realize they had some silent killers, as we call them, like high blood pressure, high cholesterol, diabetes, that were sort of brewing heart disease in them. So there's a number of settings with which we get patients. Sometimes I think there's a nervousness that people have about coming to the doctor, and they may say things like, I don't want to waste your time, or they seem like we're disappointed if we don't find something terrible wrong with them. But at the end of the day, we're all spouses and children and parents and siblings, and we know what it's like. Healthcare can be scary. It can be difficult to navigate, and being concerned about a problem is not something that I think patients should have to face alone. And it's something that we can easily resolve. So frequently we'll tell patients, we'll decide if there's something to worry about, and if there is, we face it. And if there isn't, I think we can offer a lot of peace of mind.